listeners, just a quick note about this week's episode. As we are all in the midst of a social distancing and working from home during a mandated workplace shutdown, we're also dealing with intermittent technical difficulties. Because of this, the audio in this week's episode is not as clean as you are used to. Please bear with us this week and we'll be back to normal for the next episode. Now, on to this week's episode of ALTIUS Answers.
Hello, ALTIUS Answers listeners. My name is Stephanie Dorwart. I am the host of the ALTIUS Answers podcast, as well as the CEO of ALTIUS Healthcare Consulting Group. Today, I am joined by Mr. Chad Wable. Mr. Wable currently serves as the Chief Executive Officer for Pipeline East, the CHWR in the Dallas, Texas market. Mr. Wable's career is focused on setting clear strategies supported by rigorous data-driven management approaches. His strict adherence to fiscal integrity as well as operational excellence has allowed him to consistently exceed the goals at the hospitals that he's led. As a financial turnaround expert, Mr. Wable shares tactics and strategies that all healthcare entities really should be taking to ensure that they are successful not only in the current environment, but in the days, weeks, months, and years to come. Today, we're going to talk to Mr. Wable about his passion for healthcare, where he's developed that passion, and ultimately some of the experiences he had at the organizations he's led, as well as what's currently happening at his organization during the pandemic and the COVID-19 crisis, as well as things that he is positioning for moving forward. And ultimately, as one of the leading thought experts on strategy within healthcare, we really want to talk to Mr. Wable about what steps your organization should be taking in the future to be prepared. Mr. Wable, thank you so much for joining us today.
Thanks a lot, Stephanie. I'm glad to be with you and looking forward to the conversation.
Terrific. Well, if we can you simply start by sharing a little bit about how how your life evolved to actually lead you into working within the healthcare arena, and ultimately, where did your passion come from?
Well, I'm the son of a surgical nurse and police officer, and so lots of compassion and rules in my household growing up. And I was fortunate to finish college, and I was a athlete in college, and looking forward my next competition, I guess, and happened to run into a very impactful mentor who took me under his wing and really taught me healthcare. And I've always had a passion for helping others, and that's translated into hospital administration very well. And I've been fortunate to learn from some very, very talented people throughout my entire career, both operations and strategy, and to apply that in various settings has been quite a blessing. So I'm fortunate, and I have a great team now at City Hospital White Rock in Dallas, and have had great leaders surrounding me and helping me along the way. And I all of my success is certainly shared with them.
Yeah, I always enjoy hearing the background of leaders because we all come from different experiences, and we take those experiences and apply them to our current lives. And hearing about your parents' background definitely resonates, because knowing you as an individual, I can see those patterns, in both the way that you lead your current organization as well as who you are as a human being. So you've had quite a career, and throughout that career there are some highlights. So can we just touch upon a little bit, when you think about the experiences that you've had over the last decade, 15 years, what are some of the most difficult and challenging situations that you've experienced?
Well, I will tell you, I entered healthcare interestingly at a time where things were really good, I will say. Lots of fee-for-service. I started in West Virginia at a hospital called Mon Health System, and we were performing very well and organized in a relatively well integrated, vertically integrated health system. And then in 2002, I left there and with the CEO went up to Waterbury, Connecticut, where I was able to lead at St. Mary's Health System, and that was quite a challenge, I will tell you. That was what I'll call the quintessential poor inner city Catholic hospital that was really struggling and near bankrupt, and just had all of the operating issues and and really no strategy at the time. And it was probably, as much as it was the greatest challenge, it was also the most rewarding, because I got to participate in a pretty aggressive turnaround plan there and ultimately I took over as CEO about 6 years later, and we were still in turnaround mode. So lots of lessons learned in turnarounds, as well as sustaining operating performance over a long period of time there. But the most rewarding, I will tell you, Stephanie, was seeing this poor inner city Catholic hospital transition and transform into a very successful, patient-centered, people-oriented health system that they could be very, very proud of, and with some of the best operating and quality and safety results in the state of Connecticut.
Yes, through turnaround projects at ALTIUS and throughout my career, I've also had the opportunity to experience some of those long cycles. And ultimately, you touched upon something that I think it's important to really draw out, is that, on the tail end of the turnaround at that organization, ultimately you became a very patient-centered, quality-led organization where you were focused on the outcomes. And what I have found, during my career is oftentimes when organizations lack strategy, when they lack goals, they lack the financial understanding of what it's going to take to be successful. Ultimately, underlying a lot of this is the operational steps that they need to take to actually be successful, and the understanding of what they need to do from the human element. So when you were at that hospital during the early stages, what were some of the key strategies and steps that you took to actually begin the financial turnaround? All financial turnarounds take a long time. Many times our clients want us to snap our fingers and want the transition to be done. But I think one of the things that's important to note is it takes you a long time to get into those situations. It's going to take a long time to actually move out of them. So what were some of the things you did in the early stages of that project?
Yeah, it's interesting, Stephanie, you say that, because the colleagues I work with hear me say this a lot, but you don't just sprinkle pixie dust on it and poof, it's better. It takes a lot of hard work. I will tell you, governance and leadership is critical with any turnaround, and the speed at which you're able to turn things around is, I think, connected directly with the strength in governance and the organization, as well as the leadership there. So understanding the strength of leadership and how you're going to organize that leadership and train and make sure that there's fit and competency to become a high-performing organization is very critical, is a very critical step in any kind of turnaround situation. Beyond that, you have to have vision. It's very important to understand where you're going. People want to know what the why is, and sort of what's the there with the organization, and then have people be able to quickly be able to paint that picture and understand the purpose of their work and connect to the mission of the organization, and appreciate the fact that there's going to need to be a set of changes that are going to need to be made in order to get there, so that when you're making change, when you're shifting the organization, when you're augmenting in certain ways, you're able to make that connection to the why and address that. So that's extraordinarily important.
Yeah, I think that anytime an organization is looking to go through a dramatic change and you have to orchestrate the change management around that, finding the why and grounding the entire organization to the vision is one of the most important things that leaders can do. And, as you evolve through, I loved your phrase that you can't just sprinkle the pixie dust on it. But as you evolve through, and we know it's a long cycle, there are definite change management structures and, phases. And, as you really understand that you've kind of started up towards that peak and you've reached the peak, and now maybe you're on the momentum building change within the organization and you're on the downward slide of the turnaround, and you're really starting to get the momentum behind you and things are starting to change. How does that phase really differ from the early stages? Because there's definitely a difference between the first year or two of a financial operational turnaround and that year when you finally understand that you're beyond the turnaround now.
Yeah, most turnarounds, Stephanie, are bimodal, I've learned, in the 4 or so that I've been part of. And I will tell you, the first sort of thrust of improvement is actually pretty easy because there's a lot of one-time opportunities that you usually find, whether that's in the revenue cycle or supply chain or whether that's related to payers and relationships with payers or just the newness that any leadership team brings to that, and the Hawthorne effect that happens with respect to that. But generally there's a then sort of depression of that because it just takes time to get sustainable results. Because if you'll install a new productivity system and maybe put new units of service together, that takes time for middle management, nurse leaders, and others to sort of buy into the metrics, as an example. Or there's a lag time in terms of tiering of supplies and an understanding of how you're going to catch up with any growth curve that you put out there, or new services that you're planning on kicking off, or other services that you need to close. So I have found that that's a more typical situation that more or less has occurred in my experience each time.
Yeah, I think, Chad, we both share the situation that we're very passionate about, the productivity side of the business and operational improvement. And a lot of times, as organizations are putting in place a new productivity system or they're putting in place new standards, it's a very top-down approach where the targets are pushed down on the managers, and sometimes there isn't the buy-in that really is needed to make sure that those changes last. What are some steps that you've taken with the organizations that you have led to ensure that those productivity targets are embraced and ultimately, stick around for those individual managers?
Well, it's all, I use the terminology top down, bottom up. I think there's a certain corridor of performance that you're expecting, and that's the top down. And so maybe that's policy or goal or end result oriented. But there's a lot of leading indicators, and there's a lot of things that need to be in place in the culture of the organization in order to have it be sustainable to the point that you made. So, in terms of productivity management, I'm more a believer in zero-based productivity. And so you essentially go in and build from the bottom up productivity with each leader in each department and with their teams, so that so they can understand exactly how the work may need to get done in a future state, and they can help craft that future state together so that there's buy-in. We know that there's all kinds of waste in healthcare, and when you look at a department in terms of productivity, there's just a lot of wasted steps. There's a lot of wasted issues, and so you have to, flow map diagram out a lot of what happens at a department level and build the hours per unit of service up with the teams so that there's buy-in from that. And then you have to clearly, the other thing is you got to look at skill-based staffing plans and understand that we're clearly needing to staff to demand and what is that, sort of flexibility within the flex, and then you can go on into position control, and is there truly a position control system in place, and what does that look like, and what's the actual rigor for reviewing on a daily basis staffing. And what I've found is most organizations in healthcare think of productivity as a monthly process. It's nice if it's weekly, but it really needs to be daily. And so there's literally daily management of of a checklist that you need to go through every single day to manage productivity. And if a leader's not doing that, you're probably not going to be, the probability of success is not going to be as high.
Yeah, you definitely touched upon a few key points there with productivity. You know, one of them is that productivity needs to be managed on a daily basis by the manager with an understanding of what it's going to take shift to shift to actually achieve those targets. And if everything is, you know, always managed retrospectively, or the managers aren't proactively adjusting their schedules, you know, it's going to be very hard to implement any of those changes. I think right now you've kind of walked into a very unique situation in time. You just became, you know, the chief executive officer of your current facility in about January, if I'm correct. And when that happened, we were just on the very beginning of the pandemic and the start of COVID-19. You probably had little understanding of where things were going to go, but you know, I want to talk a little bit about the community you're leading right now and the hospital that you're at. And then we can kind of drill into some of the changes that you've seen happen recently and what you've been experiencing.
Yeah, I mean, I started there right towards the end of January, and fortunately was able to at least get a good month in there to truly understand that organization, to understand the culture, to understand metrics, to study and to build a really good team. I mean, I'm fortunate to have a great team there, a talented chief nursing officer and chief operating officer, and was able to get a great chief medical officer. So as I mentioned earlier, that's obviously very important to any playbook that I'm going to have, is to have a really good team. So I'm fortunate to have a great team there that is able to take a hospital that's been that's had changing ownership over the past 3 years and you know, has not had the connection to purpose that I think it needs, and but yet is very well positioned in a really good Dallas market that's growing, and that is going to see a need for healthcare in the East Dallas market for many years to come. So yeah, you're right. We hit COVID. Actually, I think the week of February 22nd. Is when we first started. We actually had the first patient or suspected patient, COVID patient, in the state. So we got to start pretty early in this whole process, and we learned a lot with that first patient. And I think it got us really started early in the process, and we've benefited from that a lot because I think, we're able to get in front of, you know, many issues that other hospitals are facing. So we made changes and had more time to plan and understand the totality of the impact. But the truth be told is we're learning as we go here. There's no playbook for COVID. Clearly, one can say that we should have been ready for this, because every 3 years we have seen more or less a possible pandemic, from SARS to Zika to you know, other diseases about every 3 years, all the way up to COVID now. So I think we will be ready moving forward, because it seems like every 3 years there's something that comes out, and maybe it hasn't been as bad as this, but clearly it's gotten the attention of everyone, and I think it's united more or less everyone around a lot of the opportunities in healthcare to have more systemness and to really come together, which I believe we have. I mean, the governor of Texas has been phenomenal. All the governors that I've seen have been really good at this, with the hospital associations and American Hospital Association and CMS, and everyone really coordinated and working well together. I do believe that sheltering at home and what I'll call physical distancing has been important to this, and has sort of changed the epidemiology, because we saw many more deaths and the proliferation of this virus to be much more impactful than it's turning out to be. And I think it's happening a little sooner now than the original studies and all the different modelings have shown. So we're entering into the peak of this right now, and our team is doing a phenomenal job, and I'm just proud of every single one of them, all the heroes on the front line that are making a difference and doing phenomenal work right now to work through this crisis.
Yeah, we are definitely seeing heroes rising to the calling right now across the country. And I don't believe that I was aware that your facility actually was the first COVID-19 case in the state of Texas. So you definitely found yourselves on the front line of that curve. And I appreciate the fact that you referred to it, instead of social distancing, that you referred to it as physical distancing. And, one of the things that I really, thought interesting is the wording of that, with the social distance created isolation. And flipping those words, we really find out how much the actual wording of something matters, because it's really more about physical distancing. We don't want, the community to be isolated. We want people to still be connected. We still want people to work together, but it's more physical distancing of everyone in general.
Yeah, words matter, Stephanie, a lot, especially in healthcare. And I'm pretty fanatical about that. So I think of our people as team members, not employees. I definitely think of this as social distancing, as not social distancing, but physical distancing, for all the reasons that you said. It's not that we want to be isolated. It's not that we want to present that we want to be isolated, because human nature says that we need to connect. Actually, we find comfort in hurting. So this is a very difficult time for a lot of people as a result of that. And I think, that's going to present many issues for healthcare as we move out of COVID.
Yeah, and I think that one of the interesting pieces that we're all learning as we, move throughout this as an industry, as we move through this as a country, is even though, as you mentioned, we should have been prepared, we, have some type of elevated public health crisis every 2 or 3 years. There's been, calls in the past that we needed to prepare for a pandemic. Even with all of that information, I feel as if we didn't truly understand what the state of a pandemic would truly do to our country. So as we're all experiencing this, we're learning from our, mistakes, we're learning from where things are. And I certainly think the next time this occurs, we'll be better prepared as an industry, as a country. How do you think this is changing your state, Texas, and your planning in the future, or even the country in general, when we think about public health and we think about social determinants? Where do you think this is going to evolve, and what changes do you think healthcare is going to make because of this experience?
Yeah, that's a very, very good question. And I think the answers to that are being crafted right now. I do believe that there were many public health officials that warned us about this, dating back to studies from 2018 and 19, that we would really deal with these type of pandemics because of the urbanization and population growth, particularly in Asia and Africa and India. So, and those studies have been out there. We didn't think there'd be sort of this level of westernization of it, but it's just happened here. And I definitely think, to the point you made, it's gotten our attention for sure here. And I do believe that there'll be a response. I think the disaster response in America is generally pretty good, and we've dealt with some pretty significant disasters, I'll say, over the past few years. And so therefore, a lot of places have done a lot more training around this, even though not specific to COVID, but having an incident command center and understanding how to work within an incident command center and understanding the roles and responsibilities in that and how to funnel information and communicate through that process. We've actually had a lot of experience over the past few years in that, from Ebola, H1N1, storms, tornadoes, etc. So that has helped us. But I think this one is a little different. And a few things I think that will happen is, I think much like, with natural energy, we have oil reserves. I think we're definitely going to have some level of a reserve for personal protective equipment. Because we, in general, just were not as ready as I think we could have been for that. I think we're in a much better spot now. But I also believe that that will happen, and there'll be a sense of what actually does it take. I also believe that there'll be a sense of alternative, we'll call it sites beyond hospitals, that maybe could do a better job of isolating and taking care of this. I think we're learning from other countries about the efficacy of some of this, but I do believe that hospitals, although need to play a certain role in these kind of things, I tend to believe that we may be better off to have sort of a pop-up infrastructure that's more contained, that can handle this, because at the end of the day, hospitals take care of all kinds of issues, and those issues don't stop. Heart disease doesn't stop during COVID. Pneumonia doesn't stop during COVID. Depression doesn't stop during COVID. Falls and accidents don't stop during COVID. And so we're still attending to the population's health, and also being the number one source of healthcare for COVID patients. And I'm just not so sure that it's proved that that's the best way to handle this.
Yeah, I definitely appreciate the idea of the pop-up infrastructure, because it can really segment those populations and then ultimately allow the hospital to focus on treating, other patients that still need services during that time. So I think, to your point, we're definitely learning as we go through this, but there are some great strategies that are being implemented throughout the country. And I would be really interested on the, tail end of this, how the industry responds and, what structures we see put in place. So when this happens the next time, we're better prepared. And as a country, what we know is we will rise together, and we will definitely come up with a solution that's going to position us to, tackle the next pandemic overall. One of the things you touched upon and everything that you said there were the social determinants and the fact that we were warned about this pandemic, 2 or 3 years ago, and that we were warned from a public health perspective that it, was more likely because of some of the rises in population in areas, such as Asia, India, et cetera. And what we're seeing right now within the United States and some of the models and some of the, I think, numbers that are coming to fruition right now on April 9th, as we sit here, is that in the inner cities and in some of the areas that are more overpopulated, there definitely seems to be a heightened spread within the, population and more COVID-19 cases. And it's also bringing to light social determinant situations where some of the populations that have traditionally had more comorbidities or do not have as much access to healthcare are having higher COVID-19 rates. If we talk a little bit about that, how do you think that has impacted things, or, where has that really evolved, or where do you think that we see that going? I know we both have a passion for public health, and I see a lot of changes in, what we're providing from the hospital perspective moving forward into how we incorporate social determinants into our treatment plans.
Yeah, I mean, I personally believe that that it's in line with everything else we've learned about social determinants. And, the greatest determination of health in America right now, at least in America, there's been other studies elsewhere, but is the zip code. And it's all for the reasons that you just outlined in terms of their own health and access to healthcare and access to nourishment and access to good shelter and access to clean air. And those things are less in the inner city than they are in other places. And so we know that has an impact on length of life, and as well as comorbidities and chronic disease. So I think, what we're learning here is directly in line with that. And I think because this disease attacks major organ functions, that it happens to be playing out the way that it is with respect to affecting more vulnerable populations more than others.
And then as we work through this, one of the things we're starting to hear about, which is really heartbreaking, are some of the hospitals that are really having severe financial struggles right now because of the cases that they have not been treating recently. So they may have been in a situation where they've canceled 30% of their elective cases, or the volume in general has fallen as they wait for the influx. And the predictions for hospitals over the next year, the next 2 years, are relatively grim from a financial perspective, which means there are going to be a lot of financial turnarounds that will be starting. But I suspect the financial turnaround playbook, if you will, post-COVID may need to be a little bit different than it was before COVID-19. So, as a turnaround expert and someone that's been through this multiple times, as you think about these facilities, the hospitals, and even your own coming out of this, what steps do executives need to start thinking about and preparing for so that they can ensure that their organization is positioned not only right now, but over the next year, the next 2 years, to ultimately continue to provide high-quality services to their communities?
I think what I've learned over the past few years, Stephanie, is that history doesn't necessarily predict the future very well anymore in healthcare. And we've seen that play out a lot here with the shifting of fee-for-service and how population health has, a different definition based on the zip code you're in. And so I believe that, we're living in a time that's very different. And so I tell a lot of folks to sort of wipe your memory bank out, because I think that's important. Because what we did, in the past, and many hospital administrators have been classically trained, and if you didn't learn along the way and you're not really thinking ahead, I think you're going to be left in a pretty tough spot. Because I do believe there's less that you can learn from the past here moving forward, and more that you can learn real time here, and understanding what the current data suggests as to where we're going. Right now, we probably can say that there's a pre-COVID era and a COVID era that we're currently in, and then a post-COVID era. And we're right in the middle of the COVID era right now. And so most hospitals are doing what they do to respond to that. And I think doing it quite well. And most, if not all, have been recognized heavily for that. And I'm clearly appreciative of what my team and organization has done. But coming out of this is going to be a whole different world. And we are absolutely going to need to make sure that we don't snap back to what we were, because that's just not going to work moving forward, as we've trained the American public to I think, enjoy somewhat telemedicine, to understand how cost effective that it can be, to appreciate that elective procedures can be put off for some period of time, and that they truly are elective, and that there are much lower cost settings. And we clearly know that healthcare has an inordinate amount of fixed cost that is suffocating many hospitals and health systems. And so I think the turnarounds are going to be interesting, because I think they're going to be a little less operationally oriented and a little bit more focused on how do we redeploy assets, how do we do something which I've become closer to, which is this notion of shrink to grow, so that we shrink our fixed cost footprint. And we understand that we need to take healthcare where the patients are and out into the community, and that we need to understand also that half of the commercial business is with self-insured companies, and half of Medicare is with Medicare Advantage plans. And so and those numbers are increasing, not decreasing. And so that with COVID is going to mean that we're going to need to be something different when we come out of this. Maybe provide less services in fixed cost arenas. Maybe primary care becomes very different. Maybe our physician arm and how we work with self-insured companies is going to be very different. And that population health will maybe have an even different definition moving forward. So I think there's going to be a lot of work, Stephanie, in the strategy side of this, because I don't believe history is predicting the future. And so strategy and the vision of this new future post-COVID is right in front of us right now. And I think that's going to be there's going to just be a lot of work in that, because if you don't pick the right strategy, or if your strategy is based on old news, I'm not sure that's a successful path.
Yeah, Chad, you touched upon a lot of great points. And, one of the things you touched upon was the transformation of telehealth in today's market. I think as an industry, in certain cases, we've been very resistant of the virtual appointments, whether they're through telephone or they're through video. And one of the interesting things about what we've been going through COVID-19 is that we were forced over the last 3 to 4 weeks to really embrace telehealth. And, where in the past we, really weren't offering that as an option to patients in many markets, they've now grown comfortable with it. And they understand that it is a lot easier access and that there is a place for that within the continuum of care. And prior to this, I think the number was less than 10% of visits were actually virtual or telehealth. And in some markets today, it's as much as 90%. I believe it's going to stabilize someplace, maybe between 30 to 40%. But as healthcare evolves, I agree with you, there's definitely going to need to be a different model. And what has been in the past is not going to be our future. So as we all work to really determine what that looks like, I think understanding the needs of the population that you're serving becomes first and foremost, and then adapting your care plans around that. So I think everything that you mentioned there is very, very insightful and extremely useful. One of the things that I'd like to end with is, I know that you participate in an organization called MD Resources, and this organization helps to link leaders with different solutions across the marketplace. Can you talk a little bit about MD Resources? And I know you're very passionate about what they've done, for you and for other organizations, and what that organization does in general.
Yeah, I'm fortunate to have been able to connect with Greg Isley many, many years ago and have had a relationship with him. And he's the CEO of MDR, or what was MD Resources. And he has always been quite intriguing to me. And I think the business model that he's been able to create there to connect healthcare leaders and companies to solutions that really work is phenomenal and fascinating. And I think it brings the best practices that are out there, particularly in the tech space, Stephanie. And there's just a lot of them out there, and many CEOs in healthcare just don't take the time to truly appreciate what is the best practice of all of them. And to have an organization like MDR that goes out and figures out, what is the best in telemedicine, or what is the best in the revenue cycle, what is the best in supply chain, what is the best in productivity management, what is the best in fixed asset management, and so forth and so on, is, I think, a tremendous opportunity to accelerate performance and to bring the best and brightest around the table, and to ensure that the right resources and solutions get into the hands of hospital leaders to make them successful, especially during this uncertain time in dealing with the situation that we're in today.
Yeah, I think one of the great things about MDR that you touched upon is it can really shorten the time frame that it takes a hospital executive or leadership team to identify the best practice in the area that they need support. And I know that, in my past working in a hospital and other situations, sometimes you lose track of the fact of the time component and you get bogged down in the details of doing the research on multiple companies and RFPs. And you may take 3, 6, 9 months evaluating all of your options. And while you're spending those 6 to 9 months evaluating the options and going through the RFP process, you lose sight of all of the improvements that you could have been making during that time that were actually lost because you were spending the time going through all this. And I think one of the great things about MDR is they can shorten that cycle, as you mentioned, and really take you from, looking at the options that you have to the best practice solution so that you can move into implementation a lot faster as an organization.
No, I was going to say absolutely, and also provide a roadmap to success and to be able to fill some gaps in either your strategic or operating plan is also has high utility as well.
And if we want to conclude, can you just share anything that you'd like to touch upon or some lasting words for our listeners and the hospital market at large and healthcare in general that that you think are really important, not only today but in the future? Some words of leadership wisdom, if you will. Want to leave us with those, Chad?
Absolutely, I'd be happy to. I believe that this is a real opportunity for leaders to step up. I've seen, I guess, across America, certainly where I am and other places, that those that are true leaders that understand servant leadership and understand the commitment and the call that they've made and the social contract that they have with their work is playing out right now. And those great leaders are absolutely rising to the top right now. And I think each of us out there can point to those people in our own organizations. We can say, hey, that one, yes, and that one, maybe not. And so I just think now is the time, because when you're in stressful situations like this, your natural leadership tendencies play out. And we're going to need extraordinarily strong leadership as we move forward. And we're going to need to make sure that we continue to coach and mentor young folks that are interested in healthcare and healthcare administration and help them become really strong, good leaders and give them abilities to help us. I walk down and watch my kids right now when they're gaming, talking to people from all over the world. And I don't think they would struggle as much as maybe we have right now with the way that we're conducting business now, using Zoom and WebEx and GoToMeetings and what have you. They would jump right in and do that. And so I actually believe there's a lot that we can learn from the generations before us or coming up through the ranks that will really help us be even better leaders as we move forward. So having a little bit of vulnerability to do that and admit that you don't know what you know at points in time here is going to be critical, and having the confidence to move ahead and deal with these types of situations is always going to be important moving forward.
Yeah, I think that's great advice. And when we think about the generations, as they come up through, they're going to technically be a lot more savvy than we currently are and embrace a lot of those changes. And I think we're sitting at a point in time where the evolution of healthcare and the evolution of technology in general are going to really move forward at a very hyper level. And we should all be excited about the changes that are going to come down the pike. So I really appreciate your information, Chad. Thank you so much for joining us today.
Stephanie, it was a pleasure to be with you, and best of luck to everyone out there that's dealing with this situation, and best of luck moving forward post-COVID.
Definitely. And Chad, if anyone would like to reach out to you and find you either to talk about strategies and or to hear more about your current organization and your experiences, what would be the best way for them to connect with you?
They can always connect with me on my cell phone, which is published 203-228-7355. They can email me. Probably my personal email would be the best way to go about that, and that's cwable, CWABLE, @aspireresults.org. ASPIRESULTS.com.
Thank you very much, Chad. I wish the best to you as well as your organization and community as you work through the pandemic and the current situation. And all of the healthcare workers, first responders, physicians, providers, nurses, everyone in general that is on the front lines battling this pandemic. We are extremely grateful for your service and the difference that you're making in the lives of others, and the health outcomes of the country are remarkable. So really appreciate everything that you're doing, and as a country, we will rise. And Chad, thank you so much for your information and your participation today. And to all the ALTIUS Answers listeners, I hope you enjoyed this session on hearing from a financial and operational turnaround expert, not only on what needs to happen in the future, but what it's like to be on the front lines during this current COVID-19 crisis, and the strategies and tactics that are going to be necessary to lead organizations out of this crisis and move into the future. So thank you all for listening. Make sure that you follow us on Spotify, YouTube, as well as all other social media channels. And we look forward to joining you next week on the next episode of ALTIUS Answers. Thank you.
Thank you for listening to the ALTIUS Answers podcast. For more information on anything you've heard today, please search for ALTIUS on LinkedIn or Facebook, or visit us at our website, www.altiushcg.com. That's www.altiushcg.com. Once again, thanks for listening. We hope to see you again in the future.